I'm a big believer in being your own advocate, especially when it comes to your health. Getting more information and not just taking something at blanket value. I've experienced this with my own doctor, with like having higher cholesterol, having amazing blood markers across the board, yet one outlier. And it's like my dad has it, my brother has it, I have it. And again, doing more due diligence to learn about cholesterol itself. You guys know how I eat, so again, like even learning, but doing a deeper dive on my own time to learn about cholesterol in your body, food and cholesterol, and like being like, oh, maybe those two aren't so closely connected, you know? And then what other metabolic metrics are really important and kind of fit this. And then the other aspect of the health advocate is like my shoulder, like we mentioned, like the cortisone shot. So when I woke up that day, like in September, and I couldn't move my arm, and I was like, oh my goodness, I thought I tore some things. And I couldn't see my own doctor for 3 weeks, which is strange. I made an emergency appointment with a doctor, and before I went in, I was working with a rehab coach, and we had talked about cortisone shot, and I didn't know. I'm like, what is this? Like, again, like I don't want to just do something to do it. And it's like learning, like it's a temporary Band-Aid that's going to make you feel okay for now, but you could still be creating more damage on the joint, and over time it's shown that there's degrading of joint around it. So for me it was like, that's the last thing that I want to put, not the first thing. So I go in there and the doctor does some tests, and he's like, yo, you probably have this. I can give you a cortisone shot right now. And I was like, no. So, okay, I'm gonna be in more pain for a couple more weeks. Go to my doctor, see my doctor. They have me do an x-ray first. I learn a little bit more about my body. Oh, you have some calcium growing off of your, the bone in your shoulder, and that's rubbing on your rotator cuff and causing some fraying. What do you do? Oh, you do this, okay. Well, let's schedule you an MRI, and because you're a health and fitness coach, I'm not gonna send you to a physical therapist, but I'm gonna give you what they would have you do. Here's a rotator cuff conditioning programming. Or the program, so 12 weeks. Okay, so I start doing this thing. Get my MRI. MRI just shows mild labrum tear, some tears in the muscle belly of some rotator cuffs. If I go back, when they did the X-ray, he's like, you have the right shoulder, of like a 60-year-old. Like this is arthritic, and so that was interesting to me, and somebody kind of telling me about my body, which was interesting. So continue along the journey. I do that rotator cuff conditioning program. MRI just kind of confirms some stuff. Not making the progress across the next 3 to 4 months that I would like. So then I see doctor number 3. I pay out of pocket to see a specialist in Saratoga, get some like a sonogram, or what is it called, ultrasound. There's a water belly in your bicep tendon. That's interesting. You probably ruptured that at the time of injury. That might have been missed as a thought. And then learning about this whole nother arena of capsular instability, and that's where you're at, because my arm still couldn't move past here, but when he would push on my shoulder, I could get slightly more range. So that's interesting. So we should get you to talk to a surgeon about capsular instability. And I said, well, what is that? And this guy was so great, gave me 90 minutes, and I felt in the best care. Unfortunately, he wasn't a surgeon. He wasn't somebody who could, do something for me. Continue along the journey. I make an appointment with a VA doctor in Albany, 4th doctor now, sees me, walks right in, sees a guy in his 30s, does quick tests, and because I didn't fit the bill of a 60 to 70-year-old who can't wash their hair, he says, you just need to do physical therapy. Let's set you up with a physical therapist. I do 1 session, they give me some homework, stuff that we do all the time,
Yeah.
I do that. I lose a little bit of steam mentally, like, okay, my body's not where I know it. Something's not right, but I'm gonna stay resourceful, stay resilient, and keep learning. And again, all while doing this and leading and like navigating our roles here. Look into and find peptides, healing peptides. Okay, let me go down this road and begin what's called BPC, body protection compound 157, to begin injecting into my either shoulder or like my fatty tissue down here to promote healing in my body. And again, I would, just like what I would imagine a cortisone, I would feel a temporary relief, not much or at all improvement in range, but just like pain management. And I did that for a good amount of time, and then it was like, I kind of feel like, this is gonna sound funny to say, like a drug addict. Like I'm just doing this thing, but it's like a little better today, but it's back tomorrow. Like, so what am I really doing? So then it was, well, what's the next level? And it was, let me look into PRP. So then I didn't realize I could do PRP in Albany. So the first one that came up was in Brooklyn. So I drove myself down to Brooklyn, went to this pain management clinic, paid a good amount of money to get my own blood sponge and then put back in me. Did that, had again, a little bit of relief, but no real long-standing improvement. So I'm not even done, but I'm sharing like being the advocate and not just taking what's initially thrown at you. And how many doctors have I seen at this point? 4, right? That was the 5th doctor, by the way, was this guy in the city who did the PRP. So then, continue along, not making progress. What if I went to the next level and did stem cell? This is a big investment. This is thousands of dollars of my own money because it's not covered by insurance, but I'm willing, again, because surgery, all these things were the last resort for me, not the first thing. Let me try and exhaust all this while still psychologically trying to piece my mind together to not lose my marbles of this identity I've known myself, my body for so long, leading people, the changes within our own business at the time. We were operating as a duo for a while, like holding this thing together while trying to hold myself together, like all of it. And not being like, woe is me, but being like, okay, like staying focused. So flew down with a member who also, he has frozen shoulder. Love Duncan, shout out Duncan. Flew down to Texas, all in a day, one day. Flew down to Texas, drove to this facility, met these great people, got stem cell in the shoulder and in the body, so like an IV, expensive, flew back same day. Wow, felt good for like 2 to 3 weeks, like, oh my goodness, not range of motion improvement, but pain. And then again, just being like, man, I'm not making the progress in my range of motion and my pain management the way that I would want. I would still be sleeping every night, almost in pain. Really, I had a buffer after stem cell where I didn't have pain. And I'm sharing all this to show like a 18-month journey to where I am at now. And there's probably some more stuff that happened along the way after stem cell. So then I was like, man, I have to, this is now probably a year, so 14 months at this point, and I'm like, something's not right with my body. My shoulder is forward, it's dropped. Structurally, like I know my body, I'm in my body, something just doesn't feel right. So I made another appointment to go see that one Albany doctor who wrote me off in 7 minutes. But before I did, I said, let me update my imaging. Let me have resources. So I scheduled an MRI, I scheduled another x-ray. He came in and he looked at me like he saw a ghost. Like, this guy's back again in his imaging, and he says to me, I'm gonna send you to see a shoulder surgeon specialist because what's going on with you is outside of my scope. Interesting. Long story short, the VA now sends me to a shoulder surgeon. So this is Dr. 5 or 6 at this point. And I before I go into, I'm like, what am I gonna say to this guy? How do I wanna communicate? So before I went, I wrote out what I just shared here in my notes on my phone. And when I walked in, I said, can I share with you my medical history here that I have prepared for you.
Experience so far.
Yeah. Versus like, I'm in pain.
Yeah.
Or this hurts. Or I can't do this. Like, I didn't want to do that. I wanted to say, this is what I know about my body. This is what happened. This is the things I've tried. So you have as much information that's going to help you determine where we go next. Gave him all that. And long story short, he's like, yep, I looked at your imaging. I have all this data here. You know, you're in a unique category for a 37-year-old for a total shoulder replacement. And my heart kind of sank a little bit. Like, I'm not doing that.
Yeah.
So then I'm like, in my mind, in this millisecond, I'm like, I'm gonna have to be living in pain and learn how to like mitigate this journey. And he goes, but you're in luck. He goes, I think him and a guy in Florida are the only people on East Coast doing this particular surgery, and he's been doing it now for 10 years, and it's called shoulder arthroplasty with a hemi cap. And so he starts to explain it to me, and he brings out these tools, and long story short, they go in, they clean up the bone spurs on my shoulder bone, so they're not like rigid, because you can even see them. They're kind of like, a normal shoulder is nice and rounded. Mine has like these little like mountain, like Hershey Kiss like, yeah.
And how did those get there?
I don't know. I mean, just I think degeneration.
Wow. I didn't mean to interrupt.
No, it's, yeah.
What makes it round, and what makes it create like bone spurs? You know what I mean?
I mean, honestly, when I went back through and I've shared my journey, when I was in my youth, this could be a part of it, I'm not sure. My shoulder was subluxed. It was pulled out of the socket, and it was out of the socket for like 5 or 6 hours as a young child, like 5-year-old. So like, I don't like, was it never set back properly? I don't know. Then in terms of, he said this to me, which is interesting. You're not the first military guy I've seen. So it's like, were there things that repetitive, like things I did in the military that, you know, similar joint, same thing, who knows? And then of course my time within this sport itself of like putting high demand on my body and my joints through high movements and high reps over time. Could it have all moved to the perfect storm? I don't know. I really don't know, but it's a part of me, and it's like, that was the top, again, personal responsibility. Like, I did all those things. I chose all those things. This is my journey, right? And it took me a while to get here, to like this place of acceptance, because I was in denial for a long time, you know? So if I go back,
You'll clean it up.
We'll clean it up. We'll shave off that goat's beard so it doesn't rub on your labrum. That's nice. Then what they do is they drill into the bone and they start to measure the humeral head. And then from that, they get a particular measurement that they're gonna put an implant on. So now there's an implant, because my shoulder's bone on bone. There's no room, like a normal shoulder has cartilage and has room to go like this and move all about its range of motion. Then on the opposing side, in the glenoid, they drill in and they create a little space and they put this plastic piece, which again, questions. Is it okay for plastic to be in my body for long haul? And learning like, which is like fascinating, you know? He's like, and then he kind of educated me on some stuff and medical stuff, which is just fascinating. So again, being your own advocate, not just accepting.
And they're
like,
going to create space in the joint, they're going to create space? That's crazy!
Well, even if I back up, think about this is crazy to me. To get to that, do this, they have to cut one of my rotator cuffs. So then it's detached. Do all this work. I'll finish. Put that plastic piece. Now I have room where it can rock. And it's the least invasive. They're not like a total replacement. You're cutting off bone. Like, they're not doing that. So say 10 years goes by, like the 10 years it's been around, it's been very successful. People pain and going back to a healthy, active lifestyle, which is amazing. You're not limited by what you can lift or what you can do. He's like, this is great for a guy your age. And I've done younger, which is like, whoa, you know? On the way out, they have to reattach that subscapularis of the rotator cuff. And that's why for 4 weeks you'll be in a sling. And like the worst thing I could do is behind my back. So, you know, living here for 4 weeks, then you do rehab for 3 to 4 weeks, and then slow your own rehab as you enter slow like weight bearing again. And I just share all of that because so that surgery for me is next week, and I'm experiencing like a lot of mental and emotional things all at once, right? But I share all that because I'm not unique in the fact that I had something happen or occur, pain, and like, again, if I go back to the first guy, let's give you a cortisone shot. Or he told, like, you probably tore your labrum, like, just like very generic loose things. And I know this is our space, health and fitness, but I do believe, you know, your body, your health, becoming more of an advocate and not sometimes accepting, like, when I was in this interim, I would always be doing research of like, what could be the thing? And I learned about cohumeral ligament. I'm like, and I would bring it to my doctor and be like, what if this is at play? You know, because like nerve and pinching, like I'm not like I know my rear delt and my tricep they're atrophying compared to my other side, and you know something is not right within my body. And being a more educated, empowered human of their own body, bringing these things into the doctor, almost like, holy crap, like you know we're having a really high level conversation about the human body here. I think that's important. Not to that degree for everybody, but should your back hurt or should your knee hurt and someone's like, here's what you need to do, you know, or whatever. Like, okay, like let me educate myself. Let me ask a lot of questions about this, you know, and know like, you know, the cortisone, like, am I willing to accept a temporary Band-Aid? And then during that, my body's still healing. And there might be some degrading down the line that I have to accept of this joint, which it still might lead me to, I don't want to say a joint replacement, but you know, something in this realm, you know?
I think that's so fascinating. I think two things. There's a part of me that could, but then there's a part of me that absolutely couldn't, like, want to watch that go down. Like, yeah. You know what I mean? Like, I can't, like, it's very difficult for me to handle. Some people out there, like I think of a Brit, like Brit can like see it all and she is like unfazed. But like how do you do that? How do you do that?
I've spent time watching the surgery because again, it's not
you
something
did?
where, it's not some, it's, well, to the extent that I can. I'm like you, like I don't want to see it. But I'm not just like, okay, this is what I'm gonna do, great, and then like I don't think about it.
Yep.
I'm like, as soon as I get home, I'm looking up everything I can about this information. Shoulder arthroplasty with hemicap, success stories, all these questions that come up for me, like I'm looking into, I'm watching videos, reading about it, medical peer-reviewed stuff, like all the things that I can. And part of that helps build my confidence and belief in what I'm doing for myself.
Sure.
Part
it's
of
like wanting to know.
yeah, like I don't want to, just go into something blind. And the same thing, watching it go down. So I also too can have a little buffer of like, all right, what's going to be happening to me? Because again, if I go into the emotions I'm experiencing, I'm excited because a lot of what I've read is as soon as people would be waking up from surgery, like they have a noticeable difference in pain in terms of like, wow, like my pain is it's like either gone or nowhere near where it was.
And no pain from the surgery itself, like like no.
I asked that. I'm like, am I going to be hurting? And it's like, from what I got, and again, loose, adaptable expectations, no.
Yeah.
You know, they're going to do a nerve blocker, of course, but it's not, from what I gather, the most pain I would imagine I'll be experiencing is like my rotator cuff was cut and now it was reattached. I don't know how much too. And I asked them this too, because here's a thought I had. I was like, if you go in there and like shit's bad, like, are you going to fix that?
Yeah.
And he's like, yeah. So like, and I meant like, if that rotator cuff, your supraspinatus is worse than we thought, or that bicep tendon with the water belly, like I'm gonna go in and like, do whatever. It's like, can I count on you to do those things? Because this is the time that we should, because the body is
already open.
It's open, yeah. So, and even the whole process is unique in terms of like, I have to do, starting Sunday, I have to do this.
Fast?
No. Luckily, no. That's the night before. I have these wipes. So it's like sterile. So I have to like wipe myself down with like these athletic wipes like 3 times a day.
Everywhere? Or just
everywhere.
shoulder? And what's the
I think it's
bacteria?
creating the most like sterile me, which is interesting because they're just trying to lower any room for like things coming in.
Yeah.
It's on Wednesday, right?
It's on Wednesday,
okay.
yeah.
So oh wow.
And then even like, so like I was in Vegas and this woman called me and she was like, hey, I need to run through this whole questionnaire with you. I'm like, cool. So like I have to stop taking, even if it's a doubt, it's like you're stop taking it a week out. It's like fish oil, stop taking it. Ashwagandha, you're stop taking. The only thing I'm still taking it would be vitamin D, Interesting,
Why is that?
I mean, honestly, I probably just think anything related to blood and being under and like any variable, I think they want to control the most that they can.
Okay.
And you said that the surgery is quick.
I think like an hour to 90 minutes.
Get out.
Which is like, I don't know how. And it's funny because I don't even think, it's gonna sound strange, and I don't know enough, they have 2 locations. One's at a hospital and one's at like an outpatient clinic. I think I'm going to the outpatient clinic.
And you're under, and wow.
I know.
Wow.
I know. Luckily, a nurse is going with me.
Yeah.
Right? You know, so, but then like, so there's the excitement, but there's also being human, the nervousness, like my body is going to be changing form to some degree. Like I'm putting something in my body. There's I'm going under. There's like, these things creep up for a brief second for me of like, you know, say like you're going under and it's like, man, like what if something goes wrong? Or, you know, like just these things. And I'm like,
what if something goes right?
Well, of course, that's where you steer
Yeah.
yourself toward. But what I mean is like as a human, like sharing vulnerably, and then also too, like this will be, I have to essentially, probably 2 weeks at least of no exercising, at least 2 weeks. I know, and that might even extend up to a month. I've never done that. Also too, like I don't know, am I going to be in more pain or less pain? Like I don't know what to expect. Are they going to have to find things? So I think part of it all is just like leaning into acceptance, and like you just said and it's cool because even like, you know, Duncan today, it's like it's a reminder that I think the universe sends you, like, oh, because you're so fit and strong and you have muscle, like you're going to heal so much faster. And part of me doesn't want to set myself up for expectations that maybe don't unfold, because if I have a longer recovery because stuff is a little bit worse in there, like I want to meet that. But I also want to trust that, like, yes, because I'm healthy, I'm young, like I eat really well, my body is strong and durable and resilient, and this mind too, most of the time, like all those things can help me and will help me, you know, recover faster.
Yeah.
You know?
I think that's so fascinating. Like, I mean, and then think of time. You just spent 18 months.
Yeah.
So 6 months probably not go. You know, 6 months can feel will hopefully feel a little bit more condensed than the 18-month, you know, experience that you just went through. You know. I have the same feeling when like the anesthesia. Like, I ask. And you know me, I ask like 1,000 questions because I'm always wanting to know. But there's also, you know, maybe you lean into I'm gonna cozy up and I'm gonna like recover. You know what I mean? I'm gonna take this time. I had the little surgery a couple of years ago, and I remember just being like, like my husband was like, what do you want to eat? And I was like, ooh, let's get like some, you know, good food and lay down, and you know.
That's a part of it, being a business owner, that I'm kind of like, maybe again, part of it all too is you're being called to rest. Right? Like if you look at the span of what you've done since 2012, like you've been involved at a large degree for a large portion of time, and even to this point now, like I think the longest time taken even away or off is probably somewhere within a few days. You know, so it's like it's okay. And Julie said this to me yesterday, and I thought this is sweet, and it's a great nod to you and Aaron. She goes, you must feel so great to know Abby and Aaron are like can run the ship so smooth without you here, you know. And it's like, of course, you know, I think as we always talk about as teammates who care about one another, you don't want that burden to become so heavy, because you know you can help lessen it for your team. But I think again, part of it is like giving myself permission to lean into some time of restoration, mind and body, you know, like, dude, like because when I'm not, say, active in a coaching role, it's like, there's a whole nother arena that like you guys might know, our people probably aren't privy to, but it's like this arena of all the inner workings of the business and all the avenues and the areas of growth and the learning that, hey, it might be okay to just give yourself some time. Give yourself some time, you know?
And it's gonna be like, don't call it a comeback.